Today we will continue the discussion of the lower esophageal sphincter problem because this problem of the excessive relaxation of this sphincter will cause in most people actually the weight gain. Many people suffer in controlling their habits of eating because of the acidity that is burning their esophagus, so they tend to eat more food unsuitable for their diet just to relieve this burn from the acids that are hurting or burning their esophagus. So it's very important to treat this problem and know what can help you in managing this problem. We mentioned yesterday about the ginger, and we also mentioned about the metoclopramide and alginate, but there is many more important materials and habits that can help you manage this problem is, for example, melatonin. Melatonin is a very strong tonic part for this, a very strong tonic molecule to help you control the strength of and aid the strength of this muscle that is much needed to prevent the acid from burning your esophagus. And it is very good habit to consume for those who are suffering from the lower esophageal for the reflux disease. It's very important. It's very good habit to use the melatonin at night because it will help both effects. When you are sleeping, you're not eating, you will need to close this esophageal sphincter, and this will help you in both sides in falling asleep and in improving the strength of this muscle to prevent the acid reflux. Also, another important part of the diet is the choline. The choline actually is very important because it's the main part of the acetylcholine, which is the neurotransmitter of the main GI tract, more of the gastrointestinal tract. The main neurotransmitter in the gastrointestinal tract is acetylcholine, and any deficiency in the choline, that is the main part of the acetylcholine, will result in the weakness in the motility and the weakness of the muscles of the gastrointestinal tract. There are very good sources, available sources, and one of the most available and concentrated sources of the choline is the eggs. The egg yolk actually, specifically, is very rich with high quality concentrated choline. Very good absorption rate from the egg yolk is very available. And another sources is for example, the sunflower seeds are also available. Soy actually is very good source. Soybeans is a very good source of fiber and choline. Another important material that can help you, another important food that can help you manage is the fibers. The fibers, especially the soluble fibers and insoluble fibers also, but more effectively the soluble fibers that can be found in bananas. They are very good source of soluble fibers, and oats is very good source of soluble fibers. They will help improve the tone of the strength of this muscle, and also some fibers from cruciferous vegetables like broccoli, cauliflower, also legumes is very good source of both choline and good source of fibers. So the good healthy diet can help you maintain the good muscle strength in your gastric muscles and good tone of movement for these muscles, and can also decrease the irritation. You must always avoid the vegetable oils. Vegetable oils, especially fried food, is very irritative to the gastric mucosa and can also dilate these muscles and increase